What's up, everyone? Welcome to Level Up Medical Coding. I am your coder, Kat. I have over 15 years of experience in the medical business office. 9 of those years, I've been working as a medical coder. Check out my credentials up here. So today's video, we're going to go into a fairly good detailed overview about what medical coding is and the type of work that medical coders do. So let's get started with the video. First, let's just explain what is medical coding. And medical coding is the process of translating medical records and charts into codes. Mostly diagnosis codes, mostly procedure codes. And these are the services and the diagnosis that has been assigned to patients by their provider. Medical coding uses several different code sets in order to come up with a whole encompassing claim. So in the United States, we use about 3 different code sets, and they are the CPT codes, which stands for Current Procedural Terminology. Those are the procedure codes and your services codes. So think like injections, think office visits, think treatment to burns. Then you have your ICD, we're now volume 10, but ICD-10 code set, which stands for the International Classifications of Diseases. So, of course, you know that is how we communicate the diseases to our payers, in the code. So think fever, think cough, think asthma, think, bipolar. So those again are for assigning your diagnosis. And then we have, last but not least, your HCPC codes, which stands for Healthcare Common Procedural Coding System. And those codes are mainly for your drugs and your medical equipment. So think, like if you have to give Tylenol and you charge for Tylenol, the doctor charges you for Tylenol or any type of medications. Think your injections for some of your diabetes treatment. Think and your medical equipment would be maybe crutches or maybe, a walker or something like that. So as a medical coder, you'll use an electronic medical record, which is the electronic version of what a doctor writes down that's going on with the patient and everything that happened in that visit. You'll review your charts, and then you will either assign codes or audit a code that a provider has given you. And in order to either assign the code or to audit the code, you will have to have access to your appropriate coding resources. Some of these resources you can use electronically, but for the most part, it's best if you just happen to have your good old coding book handy. So again, there is electronic versions to this, but if you have your coding book, it will give you the guidelines, it will give you the path, it will give you any coding guideline detail exception that you need is in your book, more so than in the electronic lookup tool, which those are good as well, but it's nothing like the book. So either your ICD-10 book, which is what I just showed you, your CPT book, or your HCPC book. Those books won't fail you. You need those. So, but like I said, to each his own. In order to become a medical coder and work in this field, you need to pass your certification exam. Now, there's 2 main entities that employers kind of recognize and kind of trust, and like that's the OG out here in this medical coding world, and that's AAPC and AHIMA. So if you have your certification through either one of those organizations, you're good to go, you're golden. These organizations offer certification exams mainly for provider-based services, which in the industry we call profi or professional services, and they provide inpatient coding exams. A lot more exams. You can just go on each one of their websites. I'll have it in the description, and you can check them out and see what's all about. If you have any questions, I'll do my best to answer those. There are many different places that coders can go and work, so like if you are newly credentialed and you need to get a job, think beyond just a hospital. But here are a few places that coders are needed and coders work at. In billing offices, so strictly billing offices. That means an office that does nothing but bill for a provider. Coders are needed in that because we have to help work the denials. You understand what's going on with the medical charts to see if a denial can give feedback on how to get a claim paid that's been denied based on coding guidelines and regulations. Also physician offices, same deal. You will not only have to work a denial in that instance, but you will also probably abstract the codes or audit the codes that you get from your provider, or piece together all the codings from all the different providers that's seen the patient, and submit those codes to the proper payers, as well as in the hospital, surgical centers, nursing care facilities, emergency departments, insurance offices, government agencies, not limited to Medicaid, Medicare, but government agencies, ambulance services, durable medical equipment suppliers. In my area, I think of Kohl's, like a Kohl's pharmacy, and even dental. They need dental coders, and you can learn dental coding through AAPC and through a HEMA. So to become a medical coder, it's important to note that employers, again, they tend to prefer certifications from AAPC and a HEMA rather than certifications offered by like tech schools or like college courses or like these, just other schools or organizations. Like if they see AAPC or a HEMA on your resume, then they definitely can trust and verify that you got the proper education that they're looking for. It's nothing wrong with going to a technical school to learn your medical coding, but if they are offering to only give you a certification from their school and not letting you or not offering to include getting certified through AAPC or a HEMA, I would either think about the expense that it's going to cost to also get credentialed with AAP or a HEMA, or look for a school or organization that offers the credentialing through AAPC or a HEMA, or go straight to AAPC or a HEMA to become a medical coder. So there we have it. That is my intro to medical coding. So that's it. And I really appreciate you for watching this video until the end. I hope I gave you some value in this video. Now I want you to do me a favor. Only subscribe to this channel if you are interested in upgrading your coding game, because we are on a mission here, and that's to upgrade your coding, to level up your coding. So if you're interested in upgrading your coding game and watching your career soar to the next level, subscribe to Level Up Medical Coding. Talk to you soon.